Right, last one, guys, is the fight against lung cancer. Remember, the Western Front is already up. I'm going to try and get a skills one out before Wednesday, but it really depends on time. But yeah, so let's get started. Right, so lung cancer, similarly when we are talking about it in the lifestyle factors, it's a disease that's much more common post 1900. This is largely due to the war, as I've already discussed. It was caused by smoking or breathing in chemicals like radon gas. You can see in this graph the massive rise in lung cancer. It hikes a lot during World War One and post World War One when it's heavily advertised. Right, again, World War One aggressive advertisement. That's the blame. Despite making this connection, it continued to rise until the 1990s. Something basically needed to be done, and this leads to government intervention and increasing in science and technology. Right, so there is a quick diagram of the process of what you go through. So you'd get a CT scan, which creates a detailed picture of the body. You could be injected with a dye before the scan to help the lungs show up more clearly. If the CT scan shows cancer might be present in the lungs, the doctor will do one of two things. Number one, he will or she will, if the cancer does not look very advanced, the patient will be given a PET CT scan. This is basically a CT scan, except a smaller amount of radioactive material is injected into the body instead of the dye. Basically helps the doctors identify the cancerous cells. So they'll do that, or they will, the patient will be given bronchoscopy, which is using an endoscope, a tool like an endoscope called a bronchoscope, and this is passed down into the lungs where it collects samples of cells for testing. After carrying these tests out, the doctor is then able to determine what type of cancer the patient has and how far advanced it is. Right, how would you be treated then? Well, one thing you do is get it out, put in a new one. Transplants. Basically, you can replace a cancerous lung with a transplant from a donor. There are ethical problems. So if you've got lung cancer through smoking for a long period of time, some people think it's unfair to give new lungs to somebody who would choose to ruin their own. Here's examples of different transplants over the years. Here's an example of Professor Christiaan Barnard, who performed the world's first heart transplant. But they only lived 18 days before dying of pneumonia, but his heart beat quite strongly. Other heart transplants had followed. One of the main problems was the body rejecting the new organ. However, this is overcome with new drug development. So the technology around transplants is really skyrocketing, and that is a treatment for lung cancer. Right, radiotherapy. So concentrated waves of radiation aimed at the tumor to shrink it. Small tumors can be treated. This was instead of surgery. Large tumors can also be prevented from growing bigger using this method. Can be administered as beams directed at the tumor from outside the body as well. Basically, the field of radiation therapy began to grow in the early 1900s due to Marie Curie and her work. Problem is, it can get pretty expensive. A lot of low to middle class incomes can't really afford it. Operations. So if it's diagnosed early, you can basically cut out the tumor. So removing a small piece of the lung with the tumor on it, or the entire lung itself. It's possible to breathe normally with only one lung. Again, it's possible to replace a cancerous lung and transplant it with a new one, as we said before. Genetic research. So It's not yet possible to use genetics to treat lung cancer. However, they've started studying the genes of lung cancer sufferers in order to help doctors prescribe more effective treatments. So some chemo drugs work better in lung cancer patients whose tumours have a certain genetic mutation. Again, it's not quite clear why. It does show treatment can be more effective if it's prescribed for the individual rather than one size fits all. So this is a work in progress. Chemo, one that most people are familiar with. Lung cancer patients are now more likely to be treated using a range of these strategies. They might have surgery to remove the tumour, for example. Chemo can be quite unpleasant. There's a lot of side effects: tiredness, sickness, hair loss, infections. Basically, in chemo, patients are injected with many different drugs. You know, hopefully, if you've ever seen someone go through chemo, it's not particularly nice. It's kind of tough. Right, so what's happening in terms, just to finish off, between changing behaviours and influenced behaviours? Well, why is behaviour changing? Government laws are being pushed forward. We talked about previously with 2007, the banning smoking in workplaces and inside. Extended to cars in 2015, raising the legal age of buying tobacco and increasing taxation. Influencing behaviours, so banning advertisement and campaigns for healthy living. So this is the government really getting involved. So you can use this as an example to any question on government action. So there's loads of people, sometimes students are afraid of a medicine question around the government, but there's so many things you can bring in, especially in the modern period. Okay, right. Not much else on lung cancer. Just don't skip it. It could potentially be an explain question, and that'll be a tough explain question. But if you can think of the 3 different treatments for it out of the 5 I've looked at there, you'll be fine. Right, and that's medicine for you.